module, we will cover two important topics: how people react to a Chiari diagnosis, and specific tips for talking about Chiari with others. In general, people react in one of two ways to being diagnosed with Chiari. For people whose symptoms came on suddenly, the diagnosis can come as quite a shock, and the thought that there is something seriously wrong is difficult to comprehend. Someone who was healthy and active may have trouble accepting that they face a serious medical issue. In contrast, for people who have struggled for years to find out what is wrong with them and have been told over and over it's all in their head, a diagnosis can be a watershed moment with strong feelings of relief and vindication. One common response that people have to a Chiari diagnosis is actually a worsening of symptoms. It's as if once someone is made aware they have a disease, they become more in tune with what is going on with their body, and symptoms that were previously in the background come to the forefront. Another common response people have is to try to connect every symptom they have ever had to Chiari. They may wonder whether this pain or that peculiarity is due to Chiari. However, this can lead to frustration if they expect their doctor to go into an in-depth discussion about every symptom, because from the doctor's point of view, they only need to understand the most troublesome symptoms. Parents of young Chiari patients may be especially hard hit by a diagnosis. The resulting fear, anger, and even guilt can bring overwhelming stress into the family dynamic. The thought of surgery on a young child and not knowing what the future will bring can be difficult. Nancy is one of the many parents who have dealt with these emotions and fears. This is her story.
I felt like I had been hit by a truck. I was totally unprepared for it. I thought the whole thing was handled poorly, and for a whole month, I was in a daze. I'm trying to wade through all the information. I could think about nothing else. I was completely consumed. I kept thinking, how am I going to let them open up his skull? How could I get through it? He was going around saying, I have to have surgery and I could die. Every time I heard that, I cried. It was really hard because he's only 7 years old. I was a wreck.
Whether it's an adult or a child, a Chiari diagnosis can be an extreme shock. What's important is to work through the initial emotions as quickly as possible so that you can take control of the situation, educate yourself, and make intelligent decisions moving forward. Once the initial shock has worn off, something every Chiari patient must face is how, when, and what to tell other people. Each person must decide who to tell at work, in social circles, etc. Parents must decide who in their children's lives needs to know, such as teachers, coaches, babysitters, the list goes on. In fact, this is an issue that those with Chiari will face again and again throughout life. There is no right or wrong way to talk about Chiari, but there are some steps which can be taken to make the job easier. The first thing to remember is that 99% of people don't know what Chiari is, so telling someone about a diagnosis by default includes educating them to a certain degree. With that in mind, the first tip is to practice a short explanation. In the business world, entrepreneurs are told to develop what is known as an elevator pitch about their company and product idea. The concept is that they should be able to convey the general idea in the time it takes to ride an elevator in an office building. To get comfortable telling people about Chiari, develop a short elevator explanation and practice it. Try different phrases on people to see what works and what doesn't, and don't be shy about practicing it in front of a mirror over and over. There may be times when explaining Chiari in a clear, concise manner is very important. A sample elevator explanation may be, Chiari is a serious neurological problem, where part of the brain ends up crowding the top of the spinal cord, causing all kinds of problems. This short explanation conveys a good deal of information and allows people to begin to frame a mental picture of Chiari. It tells people that Chiari is neurological in nature, that it can be a serious life event, and if you remembered a point, it even tells people where the problem is. The explanation can be extended to create different longer versions which can be used when there is more time. The key, just like any public speaking, is to be prepared and practice. The more you practice, the easier it will become, the more natural it will sound, and the more effective you will be in getting your message across. The next tip is don't use medical jargon. Once you have the basics down, it's easy to slip into medspeak and throw out words like foramen magnum and CSF flow. However, this is not a good idea. Try to remember what it was like when you first started learning about Chiari and how confusing all the new words were. Don't try to sound like a neurosurgeon. Using plain English when telling others about Chiari is much more effective. Next, it can be helpful to let the other person guide the discussion. Many people are uncomfortable talking about medical issues, especially of a personal nature. One way to alleviate this is by starting with the elevator explanation and then letting the other person lead the discussion. So rather than dumping years of frustration and anger on one person in a 20-minute session, try to read what the other person is interested in. For example, one person may focus on the medical and scientific aspect and ask detailed questions about treatment and outcomes, while someone else may focus on the impact it can have on people's lives and families. Letting the other person be the guide in the type and amount of information that is given will greatly increase what they learn and retain about Chiari. The next tip is don't be negative, be matter of fact. It is almost universally true that negativity and anger turn people off. Many people will tune out someone who is ranting or venting a lot of emotion. Unfortunately, it is also very natural for people with Chiari, especially if it took them years to be diagnosed or if they are severely affected, to have a lot of negative emotions associated with it. While it may be difficult, it is also very important to not be negative when talking about Chiari. It is best to just be matter of fact, or even understated. This way more information will be conveyed in a clear manner. It's also true that people like and respond to fighters. They want to see people persevere through adversity and show resolve and determination to win. People most of all want to hear that someone will be okay, that it's a tough break, but they'll get through. In general, people don't want to hear how difficult it can be to get out of bed, or get through a day of work or parenting, or how the pain is so all-consuming. This can be true even among close friends and family. It doesn't mean they're callous and don't care, it just means they don't know how to handle something like that. It is difficult to hear about someone's pain and suffering, especially a loved one, and not be able to do anything to help. Obviously, people need to be able to vent their emotions and express their anger and frustration. It is just important to carefully consider who to do this with. Before unloading emotionally on someone, be sure they are ready and willing to take the load. It is important to be prepared for common questions. Over time, you will likely realize that people will tend to ask the same initial questions. Being prepared with short, precise responses to these questions will make you sound knowledgeable, keep people engaged, and make your life easier. These common questions include: how many people have it?
We don't know for sure, but it's considered a rare disease.
What are the symptoms?
The most common symptom is a severe, disabling headache in the back, but it also causes a ton of symptoms like balance problems, weakness, trouble swallowing, and cognitive issues.
How did you find out you have it?
I had a car accident that caused me to have horrible headaches that would not go away. So my doctor ordered an MRI, and the results showed I had Chiari malformation.
How do they treat it?
The only real treatment is surgery to create more room in that area.
Wow, I've never heard of it.
I know, most people haven't, but now that we've talked about it, you'll probably hear about it again in the next couple of months.
Finally, the most important tip of all is don't judge how other people react. While some people may seem very empathetic, many won't and may say strange and even inappropriate things. They aren't saying these things to be malicious. Rather, it is likely that they just don't know how to handle what they are hearing. Disease is an uncomfortable subject for many people, and their stress response to it may come across in a negative way. If you take offense with how someone reacts, you are letting Chiari interfere with relationships just when you need them the most. Give people time to digest what they are hearing, and don't place any expectations on what they may or may not say when you tell them. Telling others about Chiari can be difficult, especially at first, but it is an important part of navigating the Chiari experience, and hopefully these tips will help make it a little bit easier.